honor, I have to say, to be here with you all today, and so glad that y'all are able to come out and attend with us and be here with us in person today. We want to start out with some introductions. I'm privileged to be able to co-present with my colleagues over here. I have Amanda Odom and Corrine Edwards, which are both quality improvement advisors with me as well. And some of you may recognize Tina Webster, which is also on our team, and she is assisting a facility with an on-site visit today. So unfortunately could not be with us, but is with us in spirit for sure, because she works very hard with us on the team as well. So in this session, we are just going to tell you a little information about QSource and about the Culture of Safety Center project. And we'll also share outcomes from the facilities that are participating with us this year, as well as sharing a success story from one of those facilities that's currently working with us. Who we are. QSource is a healthcare leader, have been for nearly 50 years, and we work with healthcare providers, patients, and other stakeholders in making quality improvement across several states. We currently operate in 11 states, overseeing ESRD, EQRO, and QIO activities. We also are the Medicare QIN/QIO for the state of Indiana. So Tennessee Department of Health, next the mic here, released a list of the top citations in 2021, and we do have the top 10 citations are listed up here on a slide. I'm not going to cover each of those tags, but they are in your slides if you want to review those in the presentation as well. So let's talk just a minute about civil monetary penalties. So civil monetary penalties are imposed by CMS when nursing homes are not meeting those conditions of participation from Medicare, Medicaid. And what some people don't know, and we often have conversations with facilities, that 90% of those funds are actually returned to the state in order to improve quality of life and care for residents. So from those CMP funds, the Culture of Safety Center project was created. It is a collaborative effort in order to improve resident safety and quality of life for skilled nursing facilities across the state. There are two aims of this project. One is the annual summit that we get to have and hold each year. All skilled nursing facilities and long-term care facilities across the state are invited to attend with us, and we like to bring together national and state recognized speakers that can come and speak to you all and share expert knowledge with you on quality, safety, and customer service as well. So again, glad you all can be here with us. And we also coordinate regional collaboratives with nursing homes. So each year we have at least 20 skilled nursing facilities that work with us, and we assist them in completing a PIP through that year that they work with us, a 9-month period there. And we work with them on really making improvements on their quality improvement project or PIP based upon their custom needs that they need. So we have selective topics that we work on with them, and you'll hear more about the facilities that are working with us this year in just a moment. This slide just kind of shows you a summary of the work that we're doing and the driving forces behind this project. So we are working to improve quality improvement and the knowledge behind QAPI as well when we complete these PIPs. And we come in effort to try to assist and implement that continuous learning and test of change in order to spread best practices and action-oriented solutions as well in driving those quality improvements. I want to take a moment before I hand it over to Amanda and recognize our Culture of Safety Center Advisory Council. I know we have a couple of those in the room with us, so if you have if you're currently serving or have served on our advisory council before, if you could just stand up for a moment, please. I don't know that they've come back yet. Miss Julie helps on our advisory council. Julie. I don't think they've all come back from lunch yet, but we are grateful for the support of our advisory council members as well, which support both aims of this project. At this time, I will turn it over to my colleague Amanda, and she will share with you some outcomes Congress of those facilities.
All right. What are some of the benefits of participating with the CSC Collaborative? Of course, development of new skills, particularly critical care thinking skills. You know, we're coming into the endemic right now, and a lot of the things that were in the forefront prior, falls, antipsychotics, staffing, etc., they've kind of been pushed to the side because we've been dealing with other situations that come. But we're trying to bring that back into focus. And not only that, we have a lot of new DONs and administrators in our buildings, just due to everything. So it's just trying to help them out to develop those skills they need to assist in running facilities. Also, troubleshooting problem challenges. It's really hard when you have day-to-day in and out to really think about what can I do for best practices. So the collaboratives that we hold each month with Middle and West Tennessee and East Tennessee, you know, giving those best practices, you know, letting you know, hey, I'm not alone in this. I think that really truly benefits. Of course, improve your quality measure scores. If we're working on the things that we're working on, the culture of safety project, you know, once you're doing these things, the good work comes with it. You know, you have an improvement in falls. You can have an improvement in antipsychotics, you know, getting those numbers down, etc., which in turn improves your quality measures. Of course, we offer technical assistance to all of our facilities, whether that be on-site or virtual. And then, of course, data analysis, because that's the whole point of the project. You have all of this data, but what do you do with it? So you have somebody here that's to help you with really looking into your data. So just an overview of our outcomes for this year. We were able to recruit 34 SNFs in the state of Tennessee, which is awesome. We divided those up into 3 collaboratives. This was voted on per those facilities, what they felt like the areas that they needed the most help with, which are falls and staffing and antipsychotics. Out of those facilities, we were able to complete with the facilities 100% of root cause analysis as to why they felt like their project, what had broken, per se, in their project, so they weren't at where they wanted to be at. Of course, we offered 100% technical assistance to all, whether that be virtual via Teams or we did on-sites. We were able to increase our on-site visits this year, which was great. 100% performed, were able to complete their performance improvement projects. And then we also offered train the trainer modules for these facilities to really help with education-wise, what they were trying to accomplish geared toward their collaborative initiative. And then, of course, I've mentioned this prior, increase in our on-site visits. So this is a goal related to staffing. Our goal for staffing is a decrease of 10% of nurses that were terminated or resigned during the project period, and then it also measures total staff. As you can tell right here, as you can see at the very front of the graph, this is a baseline data. We gather our baseline data over January, February, March, quarter 1. And as you can see, the blue represents the overall staffing rate, meaning like the overall of everybody that left or resigned in that time period. And then the yellow or mustard colored is the nursing staff, the same, that were terminated or resigned during that time period. And as you can see, as we develop through the months, we record this data. Each of the facilities submit their data on a month-to-month basis, and we send them back collaborative graphs, and that gives us the ability to continue to focus to look at and assist them with their data over the course of the project. And as you can tell, as we move through April, May, June, and July, the percentage, our goal percentage was 10%. So total nursing staff goal for retention, it's below 10%. At 5.9, 10% would be 7.04. So that's great. So maybe that means that we're having our nurses stay a little bit longer. Maybe it means that we're assisting in developing that culture of awareness where people are really wanting to stay in this environment. We want them to stop being a revolving door, because continuity of care means better outcomes for our residents. And the same with overall staffing. Our goal was 5.2%, and the facilities have maintained at 5%. So great job for the facilities and the CSC Collaborative that are working on staffing. You've done an amazing job. So again, also reduction of antipsychotics. We asked facilities to present all residents on antipsychotics. We know that there is an exemption with your quality measures as far as those 3 diagnoses goes, according to the RAI manual. But we asked that facilities also include those residents within our numbers, so we have a true, accurate picture. So our goal overall was a 10% reduction. This is why it's extremely important to review your data and to continue to analyze. So you can see our baseline for the first quarter was 16%. And as you can see, the facilities were doing extremely well through June and even July. This is not necessarily, even though there's an uptick, it's not necessarily representative of a bad month. What we learned as far as going back to these facilities and really engaging and talking with them around July is when we started having more and more outbreaks, and a lot of facilities started opening up their COVID units. Communities prescribe completely different than we're allowed to in long-term care. So a lot of those residents might have come for short stay on those antipsychotics, and we ask that those be captured just as well. So this number is truly reflective of long-term care residents versus short stay residents. And then we also know that with acute on chronic infections, you have a lot of behaviors that increase that you're not really able to deal with at that particular point in time, and the best foot forward that you can see is medication. But that's where we come in. It's very important to look at your data trends. Where can we make improvements at? And what we discovered with this is on admission. We were able to get together some resources as far as admissions go, looking at why those facilities or why those residents had an increase in that antipsychotic, or why were they placed on that antipsychotic in the community, and really start to dive in. So those facilities had psych services set up immediately, got those residents placed on the most appropriate medication, whether it was an antipsychotic or not. So we highly expect this number to decrease in the month of August. And then the same with falls. So our overall goal for falls was a 10% reduction. So facilities have done an amazing job with this thus far. Our baseline again was gathered over January, February, March. So the blue line represents falls without major injury, and the mustard color is falls with major injury. So even though you've seen an uptick in falls, we really start to see it transpire really when we were looking at data at the end of June all through July. And again, in July, all of our counties were red for COVID, which means that not only were our residents affected, but our staff members, your staff are pulled very thin during that time because of regulations. But we highly anticipate this number to continue to drop as well. But even though you see an uptick in this, if you look at the falls with major injury, it's still well below that 10% goal reduction of 1%, which is amazing because we all know that falls are going to occur within our facilities. It's just what we do about it. So really looking at this, we were able to get back with our facilities and say, hey, let's redo our interventions. Is this continuing to work? Is there something else that we're not looking at? And really individualize that per residence, especially for those residents that are frequent fallers. So I think that's one of the benefits of working with the CSC team. So I'm going to turn this over to Tanner. He is administrator at the Community Care of Rutherford, and he's here to share one of our success stories. Thank you, Tanner.
How you guys doing? I'm the lucky one that Tina convinced to come up here and talk of all the 34 other communities that did this. As the slide says, I'm Tanner Faust. I'm the administrator at Community Care Rutherford County. I've been there for about a year and a half. And in my prior work, actually, I'm one of the people you guys love so much that moved here from California in the last 2 years. In my prior work, I was an assistant administrator, and one of the tasks I was put in charge of was QAPI. And so I became very familiar with the process in that role. And when I moved here and took the role working as the administrator at Community Care Rutherford County, one of the things I frequently asked about was our QAPI program. What is our QAPI program? What is your plan? Do you have an outline? Do you have a goal? Are you working towards anything? And it was kind of like I was like, what is our QAPI? They're like, falls. I'm like, how long have you been doing it? And they're like, years. I don't know. And I was like, okay, well, where are we going with this? And I recorded a video for this because I wasn't positive I was going to be here yesterday. But in that, I said, I don't know how Tina got my information. I don't know if I saw QSource at a convention or what, but I swear she was reading my mail, and she emailed me shortly after I got there and kind of informed me about QSource and what they do. I was like, this looks like a great opportunity. It's free, and it was them coming in to really help us rebuild our QAPI program, figure out, how a QAPI program would work within our community. And so, right here, just the three things that were kind of driving why we were using QSource. Like I said, it's free. And I can't reiterate that enough. There's plenty of programs out there that you can use for QAPI, but you have to pay for it. And if you're not having success in it, it just feels like, why are we paying for it? Obviously, refining our QAPI process, like I said, we just didn't really have a QAPI process. We had it to meet the regulations, and it was like, all right, cool, we'll show you we have a QAPI program and move on. And then, at the end of the day, obviously improving the quality of care for our residents in our community. That's what drives everything that we do. We set some goals when we were working. We sat down to look at some goals, and they're listed, top to bottom here. I'm actually going to kind of start at the bottom three there. Obviously, improving a QAPI process, figuring out where to start, to do a root cause analysis, to dig into quality measures, all those sorts of things, and find out the areas that we feel like we're deficient in, to be able to self-identify what we're deficient in, and then to start growing a plan and putting them into action from there. Improving our communication, starting with staff education regarding different practices or techniques or whatever we're doing in the community, and then just overall communication across all departments. It can start with what you're doing in QAPI, but I think a lot of us can probably say that if you go within our community, you go to your CNAs, your housekeepers, the people in laundry, the people that are probably farthest from management. We found that one of the biggest concerns that they have is communication from management being pushed down. And so, that's something that can help across the board. And then, from those three things, improving our QAPI process, our staff education, and therefore our performance, it can reduce the number of falls and improve the overall quality of care for our residents. And, those are, the goals we were shooting for. There's a graph here. Like was shared, we set out with a 10% reduction in falls without and with major injury. And you can see our baseline there is about 25% January through March. And April was kind of the first month that we started really pushing our education and pushing, what we were doing differently. And you can see the massive drop off. You can kind of ignore June and July. Still fell below the 10% rate, but we found it incredible to start actually pushing the things that we were discovering, coming up with plans, and Tina was a great instrument in just changing our thought processes and encouraging us to get creative in what we were doing. And when we started doing that, obviously you can see the massive fall off. But like I said, the months of June and July are still within that 10% reduction. But at the end of the day, like the numbers, it's important for us to show that we met our goal, and like those numbers were important. But for us working with QSource, like obviously it was important to like find success within it. Like I'd probably be less prone to like step up on stage and talk about our experience with QSource if we weren't able to find any success in the copies that we were doing. So obviously the success is important in the numbers, but at the end of the day, I think the most important thing was, do we actually have a QWOPI program going forward? Like we have a plan where, okay, we've had success in falls. This is something that we can like still focus on and set aside, and then begin looking at other areas of the program where it's not just going to be our QWOPI is falls, it's only falls, and we're going to do that for the next 20 years. Like we can start looking at other things, and QSource really gave us that. We were able to kind of identify like a QWOPI champion in our community, our assistant director of nursing, who she's not here, but Megan Mooneyhan deserves massive amount of praise for the success that we had in working with QSource. She was our direct contact with Tina, and they met frequently to discuss where we were at, what we find were working, what wasn't working, and but that's the huge takeaway for us, was that we were able to work together and to build a program that is going to be beneficial to us as a community going forward. And that's our success story.
Good afternoon, everyone. This is the last part of the program, and it might be the quickest because I'm at my little part I got to do really quickly. So, under end of the commercial, it goes so fast. If I go too fast, let me know. But I'm going to try to get on time. We are doing the next steps. Year 2 is ending, and this is we're just letting you know what the CSC is all about and what we do to help. Tanner has a great success story, and there's a lot of nursing homes facilities that we work with in year 1 and in year 2. Year 2 is ending. So the way this project goes is in phase 1 of recruiting and planning. We will go into that mode next month. We will start picking out the areas of Tennessee, and then we will start hitting and calling all the nursing homes. So when you guys get a call, don't ignore us. Don't ignore us. No. We're just trying to see if we can get you on board on this project, and we're trying to recruit you and get you in, and we can help you. I've always said with every facility that we work with, it's a partnership. It takes you to work it, and it takes me to work with you. So if you want it successful, we can help you, but for you to implement it is the second part of it, and really get in and see the difference it can make. The second phase of the project is implementation. So we will recruit nursing homes. So I know there's a lot of nursing homes here today. Please, on the back side of this, there's a QR code. Scan it in your phone. You can register to participate. We do have a lot. We want minimum 20, but we did 34 this past year. So we're not going to kick you out of the project. We really want you to work. We want to work with you. we implement it in January. So between the recruitment time and when you sign up, we're going to be calling you and we're going to start questioning you about your QAPI, your PIPs that you have, your quality, and work with you with your current project up until January, because we don't want to lose you. We just have a window where we're trying to recruit everybody. And then January, we will initiate the CSC project. So we will start with you in January. We will pick our topics that we're going to work on, and we're going to start planning our data, and we're going to hit it full force in January. Phase 3 is the end of the project, which we're at right now. We have our annual summit, and we'll also, next month, we will do our sustaining plan with the facilities that we're working with. We will also still keep in touch with you 3 months afterwards, and you're always welcome, Miss Brenda, to call me anytime you want. After that is done, our door is always open. All you have to do is call. We've had the privilege of working with facilities this year, and all of our team, we love the ones we're working with. And again, I said it's a partnership, because what you put into it is what you get out. And you know as well, working in nursing homes 18 years or more, it's really hard work, and it seems like we don't have time to do what we need to do, and that's the biggest reason a lot do not want to participate, because they're like, I don't have time. But you know what? When our issues start coming in and flowing in, we have to make time to correct it. We're good. We can help you. There's a lot of experience. I'm trying to hook, line, sinker all of you guys into participating in this project, because it's really great. It's free. Right, Tanner? It's free. And you're getting free knowledge from all of us. We take it to the team. I just worked with a facility on falls, and went to her facility this past week, and we're taking it to the team because it's a recurring fall, and sometimes we have to dig a little bit deeper on the root cause. So that is where we are right now. The facility feedback, we had 2 great ones this year. We could put more. We just put 2. 4 Oaks put on there. I would not have been able to complete anything. I've learned more than I have prior to long-term care. One of the things we did see was such a great turnover. Not enough staff in our nursing homes. They're not getting the training that they need. They don't know what QAPI is all about. They don't even know how to do a PIP. They don't know how to do root cause. They haven't been trained. So these are some of the barriers we've seen working with the facilities, and that's when they go, we don't have time. So some of the DONs that we have worked with, literally, we've been giving them some training that they haven't received in the facility. No fault. I'm not blaming facilities. It's just the way COVID's been with all of us. It's just like, get in on the floor. The day I got hired in to help with a facility, I got shoved to the floor with that no training. It's just one of those things. The second one was Briarwood, Miss Shirley. She said, this is my second project. The project has given me a new insight into how fall documentation and what is needed to get to the root cause analysis so that falls can be prevented. I would never been able to come up with the preventative measures had it not been from a collaborative work with QSource team. Again, some of us don't believe that getting to doing an RCA on a problem is not needed. We have our list that we hand to our nurses and say, okay, here's the interventions. Pick one, find one. But it's not a one fit all. So we have tried to work with problem childs and people who are falling all the time, and you're at your wits' end and pulling out your hair going, oh, great, I've done every intervention. Well, did you do the root cause? Did you look at medications? And we start picking it apart and getting down to the root cause of it. So these are 2 great ones. Year 3 recruitment. Again, the code, is on the back. It is on the back of it, and it says speaker presentations QR. If you want to download your packet, this code is on there. If you all want to sign up, I want everyone that is not participated with QSource, please sign up. We'd love to work with your facility. We're not state. This is a CMP project that is paid by the state, but we're not state. We're in here to help you, not get you in trouble. That's one of they think we are, as Alliance said earlier. So just go ahead, and we are done. We're in the breakout, right? Thank you for everyone that has attended today. We appreciate every facility that we're working with. Again, on behalf of the team, we appreciate y'all.